Hi, I'm Brittany Montez, and this is the Orlando Health News Review for February 21st. This time last year, Orlando Health's Level 1 trauma team launched the bleeding control training known as Stop the Bleed. Through this program, first responders and civilian bystanders are trained on bleeding control techniques to help save lives following mass casualty events. The need for bleeding control, referred to as BCON, can occur following car crashes, workplace or at-home injuries or falls, or mass casualty incidents. Another part of this initiative is the installation of tourniquets in the automated external defibrillators, or AED, cases throughout Orlando Health. Starting at Orlando Health ORMC, Orlando Health Winnie Palmer Hospital, and Orlando Health Arnold Palmer Hospital, these tourniquets will be placed inside the wall-mounted AED cases in areas where visitors are present and the possibility of an uncontrolled bleeding incident may occur.
Stopping someone from bleeding is one of the most effective things you can do to save their life. And that actually begins with what we call the first responder, that is, the bystander at the scene, someone who happens to just be there, and teaching them that they can use whatever they have in their hands to be able to stop bleeding.
We know that in the hospital we have a lot of resources to treat patients, but we want to make sure that they're also available to anybody that comes into the hospital, which is why we chose to put the tourniquet kits in our AED devices here at ORMC, APH, and Winnie Palmer. The bleeding control or tourniquet kits contain gloves, gauze, a tourniquet, and then also a list of instructions on what to do with those items.
If you would like to help, new instructors are now needed to assist in the effort to save lives by teaching the civilian population to provide vital initial response to stop uncontrolled bleeding in emergency situations. Check SWIFT to find out more about the criteria and the training. Next, did you know that team members now have direct access for physical therapy without visiting a physician for a referral? A new guideline from the state of Florida now permits direct access to physical therapy services for up to 30 days. We talked to Stephanie Engelberg to find out more.
Our team members are now able to come to a physical therapy appointment before going to a physician's appointment. So your physical therapist can see you and they can assess you and evaluate you. And if they feel as though you need further evaluation, x-rays or medication, or you need to see your physician, then they will recommend that you go to your physician. But in the meanwhile, you can have physical therapy care for 30 days.
Direct access has been something that's been in the physical therapy scope of practice for some time. Just recently, Orlando Health has opened up that benefit for our team members, so it's allowed team members to come directly to physical therapy. So we've seen an uptick in that over the last 2 months since they've made it official. It cuts out having to go to the physician. You can come directly to us. Just one less step, easier access, and makes everyone happy.
And don't forget to send in your videos and your selfies to healthcareweek@orlandohealth.com. Send in your video to be added to this year's Healthcare Week video, Can't Stop the Feeling, and if you send us your selfie, it will be featured in an external Orlando Health ad for Healthcare Week. Your selfies and videos need to be in by Wednesday, March 7th. See SWIFT for the guidelines and details. That's it for today's edition of the Orlando Health News Review. Thank you for making Orlando Health the best hospital possible. See you next week.